Hello everybody. Actually, I consider this video to be #1. So as I said in the previous video, everything that I post in this channel would be in regards health, in regards human body. Of course, health is not only physical help and mental help, but it's going to be also social help, because the society is made up by people. So sometimes people's disease, it can pass on and affect the society. Sometimes the society affect people's health quality. So it's a great relation, absolutely perfect relation between social health and people's health. See, now what I would like you to also be part of this journey that we're going to be together. So I would like you to ask questions. If in case that I don't details something here and you want to know more than I can offer here, please let me know. I will be much more than happy to answer to any question. And I try to be very short in what I'm saying here. That's why sometimes I don't go deep enough when I don't go in details, because I just don't like to bore people. I know the young people in our days don't have much patience to listen or to read things. So that's why I try to be short and try to cover just essence. But in case any one of you guys want to make me tremendous favor to ask questions, to go details, to go more profound in whatever I'm going to say, please let me know and I will do it, because I do pass on the knowledge and the information on this channel with a great pleasure. Is a great, I'm dedicated to do that, is my present to the world. So what I'm saying that most of the information and knowledge that I put here, there's something which I learned during my 45, 50 years of dealing with the people's disease, working in fighting various disease, various health issues. And as medical science, as any other science, always come up with something new. See, it's very hard to find everything at once. So therefore, just little by little, we find the new things, and we like to offer to the science and offer to the people. So I offer this knowledge totally unconditional. So I don't, it's my, again, is my present, is my gift for the world, because I feel that way. I feel that if I can be useful and helpful to people, which is something, is some professional sentiments that we have. I guess any health practitioner, any doctor, in order to really be very successful on helping the patient, has to have a special feeling inside to give without asking in exchange. So that's what I am doing here. Again, please let me know anything that you want to know more in relation to what I'm exposed here, and I will be very happy to be with you. Again, I repeat, will be a lot of new things that you haven't heard, and I think that I really picked up during my work. Also, I going to divide. We're going to talk about body. I'm going to divide body in looking for different angle. One will be for the structural angle, another will be functional angle, another one will be holistic angle. So each one will be probably for sure out of 3, 2 will be different that you are accustomed to. So body is a whole, and we have to understand exactly how it functions. Now today, in a couple of words, again, I never try to do much in one video, because as we are accustomed, that people has no patience. So I don't like to get you guys bored. I don't like to get anybody bored listening to me and or tired, but I'm here for you guys to answer to all the question. Again, it's totally, whatever I offer here, totally unconditional. Actually, the things that I'm doing here, by giving you guys information, we're giving you help to take care of your health. So I get in exchange one thank you. It don't have to be in words, it has to be on feelings. So if I'm useful to you, if I'm helpful to you, so that means I am helpful and useful to myself. You see how is it? Whatever you give, you come back to you without asking anything. Now today we're going to talk about, we try to look at the body for specific angle, structural angle, one that you have never heard. So I divide the body in two different parts. One is biomechanics, and another one is the biochemistry. Now, let's go one by one. Biomechanics. Actually, this is my expertise. This is my favorite part. This is something which the medical science is not very much into. So I really believe that the biomechanics precedes biochemistry. So what is the biochemistry? Just a little bit, then I'll go a little bit deeper later. Now, biochemistry is all the activity, metabolic activity throughout the body. So liver is the one that processes the food, has liver metabolic activity. Then the food, whatever is divided and is picked up by the blood and spread out throughout the body and bringing to different parts of the body. One of them is the muscles. So over there is the biochemistry at the muscle fiber. Whatever liver sends through the blood, over there just goes, is processed, and is part of it is transformed into the energy. And the other part is the toxic part after the metabolic activity at the muscles level. The waste is eliminated through the urine and fecals. You see, it's amazing how wonderful the body is created. It's very complex and it's very wonderful and a very special machine. It's amazing. I'm impressed each time I think about. So it was a day that I saw like 30-something, 40 patients, but each one was for me a tremendous study, tremendous impression how the body was created, what details, what perfect. Very, very true that the architect that created this body was extremely very intelligent, extremely very knowledgeable, extremely very detailed. You see, so that is the biochemical activity. Well, I'm going to talk a little bit more, but I won't go deep into this one because that is the whole conventional medicine is based on this one. Let's go to the first one, biomechanics, because in biomechanics there is not known much, and nobody talks much about that. I will tell you something impressive, unbelievable. Biomechanically mean movement, okay? Like you walk, while you walk. So simple, the muscle contract and expand, contract and expand. Now, see, that's by muscle contraction and expansion, it just release the energy after, as I said before, after the nutrients are processed within a muscle fiber, and part of it is a toxin which is eliminated, and part of it changes into the energy. Okay, but what does walking back and forth? So it's another wonderful thing. So by walking, there was a muscle contraction and expansion. It helps the blood circulation. In other words, the heart sends the blood through the body to bring nutrients. That's called arterial circulation. Now, when after the blood just nourish and bring the food all over the place. So then it's coming back full of toxins, which has to be toxin has to be brought to the kidneys and to the large intestine to be eliminated. Now the return circulation, since actually the whole blood circulation go through the artery, it come back through the veins, it's rely on the power of the heart, of the myocard. Now, but coming back, especially with the tall people or overweight people, coming back, sometimes the circulation comes very slowly. So therefore, the muscle contraction, walking and moving, muscle contraction helps the wall of the veins, okay, to push the blood back, whether from the legs or from the arms or from everywhere. You see, so this is the biomechanics. Now, let's talk about, this is very simple just to understand and you see it, but there is another one which is fascinating. So you breathe in. When you breathe in, the lungs expands, right? When the lungs expand horizontally, it pushes into the heart, to the myocard. So when the lungs push into the heart is contracting and pushing the blood throughout the body. Now, but there is something some part even more fascinating. When the lungs expand vertically, downwards, it push into the diaphragm. When push into the diaphragm, so that through the diaphragm movement, it push into the liver. So when the right lung push into the liver, it's going to happen mechanical movement in the liver. Now this mechanical movement against the liver or above the liver, it just help the liver metabolism. So the liver, in order to process all the food over there, now just biochemical activity, if it's controlled by the movement of the liver, so that means the activity is much, much, much better. You see here a lot of people having some angioin, some blood clog remain in the liver. It's because the lungs doesn't move the liver. It's amazing, no? Now, let me tell you even something else even more interesting. Now, left lung, when expand vertically through the diaphragm, push into the spleen. So it helps the spleen activity, to process the blood cells, to create, to control, to make them active. It's amazing. But let me tell you something even nicer. Now, when the diaphragm goes down, so you see that right in the middle of our chest, through the diaphragm is a hole where the esophagus goes down and reach the stomach. Okay, over there is the hole called pylorus, so pylor. So over there, the esophagus just open up in the stomach, in a muscle called cardium. Now, stomach digestion is totally and very, very much rely on the mechanical movement. The first mechanical movement that is helping our food digestion is in the mouth. If you chew with the tooth, with the mandibulas, inferior and superior, if we chew the food, this is the mechanical movement. The food is nicely chewed, well, whatever can be done with the help of saliva. That is, you see how here the biomechanic and biochemistry activity, they really embrace together. In the mouth, the saliva, it does some chemical decomposition of the food, but the mechanical first chew in a small pieces. So if we don't chew it very well, so the saliva, the chemical from saliva is not able to really create the first digestion, I would say, the first processing the food. Now going to the stomach. In the stomach, as I just said, when the food gets in the stomach, over there happen the second part of digestion. There's some chemical in the gastric juice. In the stomach wall, there are all the kind of formation which secretes some hormones and some other substances which make up the gastric juice. But the stomach has to move in order to really help those glands which are on the wall of the stomach, they have to, all those glands, they have to be activated by the movement. So where the movement come? For the same lung. Pushes down into the diaphragm, and the diaphragm will create a movement up and down, and the stomach move up and down, and the stomach wall, not abdominal wall, the stomach wall. And the stomach wall, it just start moving up and down, and just helps those small formation, more small islands, which are responsible of creating some hormones to really enrich in the form the gastric juice in order to decompose, to create the stomach digestion. In other words, to make whatever we take in as a food in an extremely very small particle, they are decomposed in extremely very small particle, and so on, so on, so. But let me tell you something else even more interesting to know about mechanics. It's amazing how the mechanics works. Now you see, we in our food, which go in the small intestine, then in a large intestine and a colon, and go from ascendant colon in the right side, transverse crossover to the left side, and go down the left side in a sigmoid to be eliminated outside. Now, for that cheme called intestinal cheme, in order to move, it needs a mechanical movement. Now, the wall of the intestine, it just contract and expand, very light, very, very, very small movement. So how does this happen? The same thing. The stomach pushing up and down, it just, the stomach, the diaphragm push up and down, pushes the stomach pushing the duodenum, and push also onto the, activate, move up and down the transversal colon. So over there where the transversal colon, over there, that's what helps the peristaltic movement and help the intestinal cheme to go out. If the lungs doesn't move vertically, it suffers all those organs that I just said. Now let me tell you something else even more interesting, or maybe just as interesting. For me, all are fascinating. Now, in the right side below the liver, there is a bile. Okay, it's a choledog, cholecyst, whatever. So there is a mechanism which, again, through the movement, through the diaphragm movement, which move the liver up and down, from the liver, it just release into that canal which go in the bile, and this like a small balloon. It's just released over there the toxic the toxic substance which result with the hepatic activity, hepatic metabolism. So that is collected in that vesicula in the bile. It's called the biliary fluid. So that one is pushed into the duodenum and go to the intestine. That is a toxins which is eliminated through the intestinal cheme. But there is something else. Some of this fluid, it's very responsible to some intestinal digestion. It's very important at the digestion of the lipids. You see, now if the diaphragm doesn't move up and down, helping the liver to go up and down, over there happen two things. One is the hepatic metabolic activity, which divide everything into tiny pieces, and then pushing the liver up and down like a pump, squeeze it, and the fluid, the bile, goes into the vesicula, and from there it goes on. Now, you see, a lot of people, this is something which nobody talks, and I don't know if anybody understands. Now, if the liver is not move up and down, its activity, his metabolic activity, is suffering. Therefore, a lot of people at a certain age who doesn't have much physical activity develop high cholesterol or triglycerides. So it's happened all the kind of problems. Now, that is my opinion, because liver doesn't function proper. Why? Because it doesn't benefit of the biomechanical activity. You see, it's a biomechanical in the liver, which everybody has a high cholesterol, everybody has a problem with the triglyceride, because the liver's metabolism suffer for the lack of this movement. So appear more towards the elder age when people don't do much. Okay, so it said, well, keep a diet because you eat fats. It's not true. If people eat perfect diet, no fats, and the cholesterol is high. You see what happened? So that is the things in regarding liver. I pay a lot of attention of that one through my practice, and I try to help people. So I understood this one, which is very important. People have constipation because they don't move, they don't breathe, don't expand the lungs downwards, up and down. It's a lot of, I have to tell you guys, this particular video, it can be extremely very helpful to all of you who are interested to be healthy. I hope some hundreds of thousands of people see this video, because through this one you can help a lot your health, to improve your health. Now, I don't have the time. Actually, I have the time, but I don't like to keep you here, you know, to bore you with so many information, to be too long. But it's so much to talk about that. Now, another thing is, and also the movement of the lungs up and down through the diaphragm, create an abdomen movement up and down, also help a lot. Also as I said before, the veins circulation to release the toxin into the lungs, into the urinary vesicula. You see. So a lot of people sometimes develop urinary tract infection because the vesicula, the urinary vesicula doesn't contract. It doesn't contract because that doesn't receive the movement from the lungs through the diaphragm through the abdomen. See, so if doesn't really contract very well, the fluid in the urinary, the urine stays there longer and just create toxicity and sometimes create inflammation. Well, there are more things here. We're going to talk more about that when we take one by one. Now you see with the heart, it's the same thing. You see how nice is the body, the thoracic done. Is the ribs, which for classic point of view is just to protect the inside organs within a thoracic. It's very true, but see how nice is adapted. It's made by ribs, long bones. In between there is a muscles. Why? That thoracic can expand up and down. The muscles stretch out, the intercostal muscles stretch to allow the lungs to expand up and down, up and down. See? Now, as I said before, when the lungs expand, the heart is the one that starts pumping. So if you don't breathe proper, you know, so then heart doesn't contract, heart muscle doesn't contract proper, and appear that insufficient, not enough power of the heart to push things away, to push things down, to push the blood through in the beginning through the artery and then through the veins. It's so much to talk about lungs. Also, lungs expand up and down, also stretch the muscles of the back. So the muscles of the back stretches up and down and just keep over there the spine in a flexible, stage, because the spine has to be very flexible. See, there are vertebrae in between, there are those discs, so they are connected to each other with the small muscles. Those muscles, intervertebral muscles, they have to stretch up and down, also done due to the lungs expansion. It's so much to talk here, really a lot. But I think I am here. But you see, when you're going to urinate, so the bladder muscles has to contract in order to push the urine out. This is another biomechanical activity. If they don't contract enough, as I said before, the urine stays longer over there, and not only stays longer, yeah, stays longer and affect, of course, the quality of inside mucus on the bladder, but also can happen, instead of going out, create pressure, the pressure goes back in the kidney through the superior urethra, so ureter, so that's the way it builds up sediment into the kidneys like stones. So that is a part of the mechanical movement. People who has a low back problem, so those low back muscles, they don't stretch, they don't contract and stretch proper, because some tendonitis, some disc problem, so the muscle become contracted and they don't expand. Now, because they don't expand, they don't create movement in a lower back up and down to help the kidney also to contract and expand, to contract and expand, because that's the way the kidney work also. Whatever chemical activity, metabolic activity happen in the kidney, when the blood goes a toxin, they are taken in order to remove outside. But also the kidneys has to do some mechanical movement, some mechanical activity. You see, this biomechanical is a primary structure which help the function. With any biochemical activity in the body has to be prioritized by the biomechanics. You know what? I'll tell you something very interesting. So when the baby, when you give birth to the baby, the first things, the baby breathe on its own. When breathe on its own, so the lungs expand, and then it starts the whole body's activity, mechanical activity, start on its own. Before, it was just being connected with the mother, right, in a wound over there. So it's mother heart is the one that pump the blood, pumps everything, plant everything in the inside. But once the baby comes out, it has to stay in its own. So it's the first gulp of oxygen that gets into the lungs, and the lungs expand, and just everything starts moving. Okay, here there is another work together: biomechanic, lungs. I mean, the oxygen is sucked in by some muscles, and the biochemistry, the oxygen is getting in and is pushed through the through the lungs in the blood vessel, and goes to the heart, and heart pushes the oxygen throughout the body. So if the biomechanics doesn't function proper, my friends, the body's biochemistry doesn't do proper. Now, in the next episode, is going to talk about biochemistry, which probably I'm not going to talk a lot, because you guys can know a lot. But I will just give you a couple of opinion how the biochemistry follow up biomechanics. Until then, I just wish you good luck, and really watch this one. It's 1, 2, 3 times. It's very interesting. And I will tell you one thing. If you want to be healthy, breathe expanding the abdomen. All the athletes, I work many years with the Olympic team of some countries, with athletes of high level, high arrangement, and in order to really maximize the capacity of the liver, of liver activity, and not only to maximize the capacity of the lungs to take in oxygen, you have to breathe downwards. When you breathe in, you have to feel the stomach expand. That is the key of biochemical activity. That is the key of the well function of liver, spleen, gallbladder, I would say stomach, intestine, etc. Okay, so now good luck on processing this video, and I'll meet you next time. Take care, guys.